Hi, I'm Dr. David Purves. In this short film, I'm answering this question. What is Cognitive Behaviour Therapy, or CBT for short? Well, CBT is a form of face-to-face psychotherapy. Now, when I say the word psychotherapy, you may immediately have images of Sigmund Freud having a patient lying on a couch for years on end talking about their childhood and not getting any better. Well, that's pretty old stuff, over 100 years old, and pretty much nobody does that anymore. No. CBT is efficient, effective, and evidence-based, which means it's a form of face-to-face therapy which helps you to resolve the problem that you have now. We're less interested in the past and we're more interested in helping you to resolve the problem that you struggle with now and have a better future. You would typically see a CBT therapist for between 6 and 16 sessions, and in the majority of cases, if you complete the course, that's sufficient to fully resolve the problem that you struggle with. And if it's not fully resolved, you've at least got a tremendous lot of benefits from that experience. So CBT therapy is definitely a form of face-to-face therapy that changes your experience and gives you actually what you want from the therapy, which is to feel a whole lot better. Now, typically, it's the feelings that you have, it's the emotions that you have which are causing the trouble. You know, you feel down or you feel anxious, and you feel stressed, you feel panicky, you feel out of control. The emotions that we have, this emotional experience, this negative emotional experience is what we want to get rid of. But it's hard to directly access and change emotional experiences. But what we can do is get at them slightly indirectly. Cognitive behaviour therapy. The cognitions, which is the thoughts, images, assumptions and beliefs that you have about yourself, your world in which you inhabit, and the future, cause you to have particular emotions. And when you start to feel a bit down or anxious, or when you start to have psychological problems, often your thought processes become more extreme and unhelpful, and therefore your emotional response is also going to feel more extreme and unwanted. Likewise, when you start to have emotional problems, you start to do less things which are helpful to you, or do more things which are unhelpful to you. And when that happens, it actually makes the problem, the emotional problem, worse. So cognitive behavior therapy has 2 points of intervention. The thoughts, beliefs and assumptions that you have about your experiences, and the behaviors that you do or don't do which are unhelpful. A course of therapy helps you to identify these and change them. And when you do that, you regain control over your emotional experience, because your emotional experience becomes more calibrated to the world in which you live and less calibrated to the unhelpful and extreme thought processes that you may be experiencing right now. A course of CBT is really helpful. It can be life-changing. If you're thinking of visiting a CBT therapist, please make sure that you find a therapist that is accredited by an appropriate body. In the UK, the accrediting body for CBT therapists is the BABCP, British Association for Cognitive and Behavioural Psychotherapy, babcp.com. You'll find an accredited therapist on that website from all over the country. I hope you found this information interesting. If you're thinking about CBT, give it a try. It really will change your life. Thanks for taking the time to watch and listen. I'm Dr. David Purves.